Okay, so welcome to the staff meeting at Marina Hills Animal Hospital. Today, for our medical moment, we're going to talk about wound care. You all saw the patient that we had earlier this month that had a large mass on its tail, and it took up more than half the skin around the tail, and that wound had some complications. The challenge is that when we close a wound, we'd very much like to close the wound with skin, but there wasn't quite enough skin to go around. So we made a valiant effort to do some plastic surgery to make some releasing incisions around the side of that wound so that we could get closure on the main incision. Unfortunately, the dog had poor circulation and got a secondary infection, and it got quite yucky. So we ended up with a surgical wound that turned into a yucky wound. The first thing we did is we had to treat the infection, and so it was lots of antibiotics. It was wet to dry bandages, so that as tissue was sad and needed to come off, that we were removing it both with dissection as well as with the bandage material. But once that initial infection was under control and we had good blood supply, then suddenly and rapidly it started to heal. And the term for that is granulation tissue. If you've seen it when the bandage is off, it's pink and it's glistening, and that makes us doctors smile because we know that granulation tissue is going to form scar tissue and the wound's going to heal. And in the last week or so, it's shrunk by half. In the next couple weeks, it's going to totally shrink up and do fine. So the take-home message is they don't always go the way we want them to, but if we stick with it, we can get these things to heal. And the net result is he's going to be able to keep his tail. He came in with a really huge tumor, and it wasn't clear if we could save his tail or not. But in fact, he is going to have a tail when it's all said and done. So that's the good news in this story. Any questions about that?
You guys abraded it.
Yes, yeah. So the tissue that was gray and black and slimy had to come off, and so we surgically removed some of that tissue to speed up the healing. Yeah.
If you would have just amputated it, would you still have had the same chance of getting that infection?
Probably not. Probably if we had amputated his tail above the mass, it would have just healed just fine. He would have needed more pain control because that's a big deal surgery,
right.
And he would have then been a stub-tailed golden retriever, which, that's not our favorite. So.
Yeah.
Did you use the laser?
Yes, we did use the laser for healing, to speed healing. Yeah. So one of the modalities we were doing to encourage this wound to heal was the therapeutic laser. Yeah. Another question?
Would a graft been beneficial for him?
So skin grafts take best when they're attached to healthy tissue or to granulation tissue. So in the midst of his nasty, smelly, infected wound, absolutely not.
Right.
Yeah, it would have failed. The challenge is to find tissue that you can rotate and maintain its blood supply. And there are some ways to do that. It's pretty interesting. A big pedicle could have been taken from his hip and turned and put down. So that would have been another approach. Yeah.
What was the mass?
It turned out to be benign. That was the good news. Yeah, it was not a malignancy. It was huge, but it was not a malignancy. So we don't expect anything to grow back, which is also good news for him.
Right.
Right. Okay, good. Thanks.